I'm Catherine.
Okay.
I've worked at the Disability Alliance of BC since April 2023. Prior to this, I worked in healthcare and have a Bachelor of Science in Nursing and Associate's degree in Creative Writing. I'm also a person who lives with disabilities and was diagnosed with multiple sclerosis in 2017. And at DABC, I help people one-to-one to apply for the disability tax credit.
Hi, I'm Ophelia. I've also worked at DABC since January of this year. I help people apply for the disability tax credit as well, like Catherine. And prior to this, I worked with a variety of nonprofit organizations supporting families, children, and people with disabilities. I live with fibromyalgia and some mental health related disabilities as well.
So we have a land acknowledgement with gratitude. We want to acknowledge that we live, work on the traditional, ancestral, and stolen territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. We honor the territories and the Indigenous people who inhabit this land.
Okay, so to start off, what is the DTC? So the DTC was designed as a non-refundable tax credit, which is intended to help cover the extra medical costs that Canadians with severe or prolonged mental and physical impairments have to pay. It's non-refundable, so that means that you will pay less income taxes if you have the DTC, and the credit helps people with disabilities or their supporting family members reduce the amount of income taxes that they pay. So it won't be a refund right away, but it would just reduce the overall amount of income taxes that you would pay. Okay. The main benefit of the DTC is paying less income taxes when you file your taxes, as I mentioned. So for the 2024 tax year, the amount claimed is $9,872. So the non-refundable rate is only 15% of this amount, which means that your taxes may be reduced by up to $1,480. And the DTC can also be retroactively applied for up to 10 years prior to this. So depending on when your disability began, any amount of income taxes that you would have paid back then, if you had the DTC, can still be refunded to you. So this depends on when any symptoms of your impairment started. So for example, if you had difficulty with your balance while you're walking, for example, since 2015, then the CRA would be reassessing your taxes since 2015, and you might receive a tax refund. If you're not paying income taxes before then or just right now, and you were, for example, on PWD or you're not working, so you wouldn't be paying income taxes, you won't be receiving a refund for those years, but you're still able to transfer the unused portion to a supporting family member to help them get a reduction in their taxes instead. So transferring the unused portion is how a supporting family member can benefit. A supporting family member, as according to the CRA, would include a spouse, common law partner, a child, parent, grandparent, grandchild, brother, sister, aunt or uncle, or nephew or niece. And if the family member or your spouse pays for your things like groceries, rent, or clothing consistently, then the family member's information can be added to question 3 of Part A of the DTC. And how this works is that the disability amount will first be applied to the applicant's taxes first. So if you were applying, it would be applied to your taxes first. And then whatever is unused would be applied to the support person's income taxes. So for example, if you had a spouse that was your support person, it would be applied automatically to their taxes. Spouses, parents, guardians, and legal representatives can get their taxes reassessed automatically for those past years retroactively. And other family members on that list, like for example, an aunt or uncle, or a brother, sister, they will need to request a readjustment from the CRA by a letter or by submitting a T1 adjustment form. Okay. This sounds like a lot, but you can also get all these other benefits when you're approved for the DTC. So just going through it, one of the most important ones that a lot of people would be eligible for is the Canada Disability Benefit, also known as the CDB, which is the newest federal benefit. This is up to $200 per month for people aged 18 to 64 if they meet the income threshold. So this benefit doesn't impact disability benefits like your PWD payments. There's no clawback, so you're still able to get it even if you're on PWD, and it wouldn't drop down your PWD payments. You can also get the Registered Disability Savings Plan. So the RDSP is a long-term registered savings plan, which helps people with disabilities plan for the future. You're able to receive up to $90,000 in government contributions until you turn 49 years old towards your RDSP. So even if you don't put in your own money, you still can receive this government contribution if you are under 49. And Catherine will speak more in depth about these benefits, the CDB and the RDSP as well. And you're also able to claim extra medical expenses like therapies that you receive. For example, if you're going to a psychologist, a doctor, nurse practitioner, or occupational therapist, you can claim these on your taxes. But however, this is non-refundable though. So you wouldn't, it would just reduce the amount of income taxes that you pay, much like the DTC itself. You wouldn't be getting a refund for those expenses. And this is the same if you were charged a fee from your doctor or nurse practitioner to fill and sign the DTC form as well. So you can claim this fee on your income taxes as a medical expense. There's also the Canada Caregiver Credit, the CCC. If you are a supporting family member who has supporting a family member who has the DTC, you are able to claim the CCC, which is the amount that you can claim for a family member that is 18 or older, like if you're supporting a spouse, an adult child, a parent, grandparent, grandchild, brother, sister, uncle, aunt, nephew, or niece that is over the age of 18, you're able to claim $2,616. And if your dependent had a net income that's between $8,000 and $28,000, around there, you can claim an additional $8,375 as well. And there's also some home-related benefits that you can claim. So one of them would be the home buyer's amount. So if you or your spouse or common law partner are buying a qualifying home that you don't already live in, or another home owned by either of you in the year that the home was bought, or any of the 4 preceding years, you can claim the home buyer's amount. And this would help you with with the DTC. So then another benefit is the home accessibility tax credit. So if you need to renovate your home to make it more accessible or safer for you because of your disability, so this could be things like adding ramps, grab bars, replacing a bathtub with a walking shower, raising the toilet, things like that, you can claim up to $20,000 in eligible expenses when you have the DTC. There's also the home buyer's plan. So you're eligible if you are buying or building a qualifying home for a person with a disability. So this allows you to withdraw up to $35,000 in a year from your RRSPs. And lastly, there's the multi-generational home renovation tax credit. So that's a refundable tax credit, which allows you, an eligible person, to claim certain renovation costs to create a secondary unit or just a suite, for the person with the DTC in your home. So that could be a senior or an adult that can live there and has the DTC. The DTC is not directly connected to your diagnosis. Instead, it focuses more on how severely you're impaired by your restrictions. So you need to provide specific examples of your impairments and explain how they impact your daily basic activities. And I'll just get to the basic activities in a couple slides. The DTC also does not depend on if you can work or go to school, or on your income level or assets. So it doesn't matter which age you are or your income, as long as you're eligible, you can still apply. So to be eligible for the DTC, you must have a social insurance number and a severe and prolonged impairment, which can be mental or physical. So a severe impairment means that you have either a marked restriction, or a cumulative effect of significant restrictions. So a marked restriction means that you are very restricted in one basic activity of daily living. So that means you can't do that activity, or you need a lot of help to do the activity, or you take a lot longer to do the activity than most people. Specifically, you take 3 times longer than someone else your age with no restrictions. A cumulative restriction would be a cumulative effect of significant restrictions, which means that you are restricted a little less, but in 2 or more of the basic activities. So if you take 2 times longer than someone else your age with no restrictions in 2 or more of the categories. And you can also need life-sustaining therapy, which would qualify for the DTC. And it's a bit different than a marked restriction or cumulative restriction. It means that you need a therapy that keeps you alive, like kidney dialysis, and also takes up a lot of your time, about 14 hours. So prolonged, when we said severe and prolonged impairments, means that the person's impairment has lasted or will last at least 1 year. So for example, with impairments related to Parkinson's, we know that these will likely last more than 1 year. And the DTC also asks if impairments happen substantially all of the time, which means that they happen at least 90% of the time, or all of the time. So if you have flare-ups or bad days where you have like severe pain or really bad symptoms just on some days, you might still be eligible for the DTC. In these cases, we'd like to explain how severe your symptoms are during your flare-up and how often the flare-ups occur, like every other day or every 3 days. And we would always say that due to the unpredictability of a flare-up, you are restricted all of the time substantially. The CRA determines eligibility, so it's always a good idea to apply to see if you'll receive the DTC just based on your restrictions. So the basic activities that I was talking about are vision, speaking, feeding, which includes eating and making food, hearing, walking, eliminating, dressing, and mental functions. So feeding, we want to make sure that it includes things like eating and making food for yourself. So your ability to like stand, stir things on the stove, if you can make a full meal by yourself without taking a lot of breaks, things like that. And then for eliminating, that would be bowel and bladder functioning. So things like IBS would be included here. So someone could either have a marked restriction in just one of these categories, or they could have cumulative effect of significant restrictions if you take two or more of these categories. So for example, if you cannot prepare a full meal by yourself without taking breaks, and you take a very long time due to pain or fatigue to prepare that meal, or you can only make a microwave meal or quick meals, that would be a marked restriction in feeding. And if you take twice as long, for example, to speak because you stutter and can't articulate your words, or have long pauses in your speech, and you also have trouble balancing, coordinating, or shuffle your feet while you're walking, that would be a cumulative restriction as you are restricted in two of the categories. So as I mentioned, you need to provide very specific examples about your impairments and explain how they impact the basic activities. And I'll explain how to do that for each section. So for the speaking section, we usually focus on if they use sign language to communicate, if they take any medications, or use any devices or therapies, like for example, a communication board, voice amplifiers, speech synthesizers, or need the help of a language pathologist. And we usually focus on restrictions in terms of if the person has any word finding difficulties, stutter, or ask for repetition a lot. And if their voice is too quiet, as in like they can't be understood by others because they're too quiet, or they seem really strained or hoarse. And if they're unable to speak in certain situations, for example, if they have anxiety and they're unable to speak in front of large crowds due to anxiety. And one thing we always want to do for every section is say how often these occur. Like our scale would go from occasionally, often, usually, or always. So saying something like the person stutters always and has pauses in their speech usually, and saying something like it takes twice as long or three times longer for them to speak compared to someone their age with no difficulty. For walking, we would focus on if they take any medication to help them with their pain management, or in general with any of their restrictions or diagnoses, and any devices or therapies they use, like orthotics, supportive footwear, if they're wearing shoes in the house, perhaps, or if they're wearing using a walker or cane, any type of brace like a back brace, knee brace, things like that, or use like heating pads or cold packs for pain flare-ups, a commode at their bedside because they cannot walk to the bathroom at night. And if they've tried any therapies like physiotherapy, occupational therapy, massage therapy, get any support from a podiatrist, things like that. And we also mention if they need help from others to walk and the frequency, like the patient needs help to walk from others often and always needs help when they're in a flare-up or having a bad day or have more pain symptoms, or perhaps in the morning when they experience stiffness. And we also focus on the restrictions in detail. So for pain, our scale goes from mild, mild to moderate, moderate, moderate to severe, and severe. And then we focus on how often they occur as well. So saying always, usually, occasionally, yeah. And then if they have flare-ups, always mentioning the flare-up as well as how they feel on a regular day and on the flare-up day. So for example, we would say something like they have a severely limited range of motion always, and moderate pain in the back and legs usually. It takes them 10 minutes to sit up at the side of the bed in the morning and begin walking due to stiffness. And for feeding, we can focus on if they use a feeding tube or any medications, and any devices or therapies like cups with lids if they spill drinks or food, adaptive dinnerware like lighter dishes or plastic dishes that are easy to hold or don't break when they're dropped, or perhaps they have trouble washing the dishes, so that could also be like disposable plates, disposable cutlery, things like that. A shirt saver if they need thickened fluids or a soft or minced diet to help them chew and swallow. If they need to supplement their diet with protein replacements or supplements or meal replacement drinks, and ready-made meals like microwave meals, pre-made meals, eating out, takeout, things like that. And then also any devices that help them not burn food. So things that turn off automatically, like an air fryer, rice cooker, slow cooker, things like that. And as well, any therapies that they might have received, like occupational therapy, if they go to a pain clinic, massage therapy. Like for the walking section, we want to focus on the restrictions in detail. So we want to say how often it occurs as well. So besides the pain, experiencing pain in their body, we can also focus on any jaw pain or mouth pain and limitations with chewing, choking, or swallowing, things like dry mouth, inability to chew or swallow because of pain. And we can say things like they have moderate fatigue and tremors in their hands usually. So that impairs their dexterity, and they can only make quick or simple foods like eggs, sandwiches, and only heat ready-made meals in the microwave, things like that. So So the mental function section is a bit different. So this category has different subcategories, and there's a bunch on the screen here. So adaptive functioning, attention, concentration, memory, judgment, perception of reality, problem solving, goal setting, regulation of behavior and emotions, and verbal and nonverbal comprehension. So this section comes with a checklist where the doctor can check off no limitations, some limitations, or severe limitations for each question, and then explain exactly how you're restricted on the next page. So no limitations would mean that you can do the question really easily without any help. Some limitation would mean that you procrastinate doing these tasks, or you do it, but it's very difficult for you, or it takes you longer. And severe limitations means that you cannot do it, or you need a lot of help to do it. So a very limited capacity in any of these subcategories would still qualify as a marked restriction, so taking 3 times longer than someone else your age. So the form asks specific questions under each subcategory. Like for goal setting, it asks you about your ability to make and carry out simple day-to-day plans and self-direct to begin everyday tasks. So for example, if you cannot make plans because you lack motivation or focus, or take a long time to prioritize your tasks, or procrastinate all your tasks, that would be a marked restriction. Okay, so here are more things to focus on for the mental functioning section. So things like taking medication, we'd need to elaborate on how effective your medication is and if they need any reminders to take it, and if they use any devices like medication blister packs, memory aids like alarms, timers, calendars, planners, post-it notes, needing to write everything down, and GPS, any apps that might help you, like a to-do list, meditation apps, things like that. And then any therapies that you receive, like support groups for Parkinson's, DBT, CBT, therapy, things like that. And then for the mental functioning section, for example, we could probably write things like patient is unable to complete self-care tasks like basic hygiene, so brushing your teeth, showering, getting out of bed in the morning, and skips meals due to lack of motivation and severe depression, which occurs 4 times a week or like 4 times a month. And can last up to 3 months at a time, something like that, would kind of focus on the how frequently it occurs. And we can also say things like patient has difficulty keeping track of which medications they took, and they have doubled or missed doses often or always needs reminders or prompts to take their medication. The form also asks for this section if they have the capacity to live independently. So the answer would be no if they need a lot of support from their loved ones, like family, friends. So things like if people need to help them meal prep, clean, pay their bills or help them pay their bills, needs like prompts and reminders to do basic things like brush their teeth, shower, attend appointments, help to schedule and attend medical appointments, or any support or encouragement to manage their mood or safety, or keep their anxiety at bay, things like that. Other supports would be if they're in an assisted living facility or access any community-based health services like group therapy, support groups, or have been hospitalized for any mental health crises. And here again are more examples for the mental functioning section and also ways to word the explanation. So again, it's important to explain in detail and include how often things happen, like patient experiences anger or crying outbursts daily or every other day, and they experience low mood and depressive symptoms every 4 days that can last up to 2 weeks at a time. When they're in these states, they lack appetite, skip meals, cannot attend to basic hygiene tasks due to lack of motivation, procrastination, or just general fatigue. To qualify under the life-sustaining therapy category, you need to be in need of life-sustaining therapy to support a vital function. So you need to have this therapy at least 2 times a week for an average of 14 hours per week. So examples of this would be insulin therapy for diabetics or kidney dialysis. In fact, type 1 diabetics are automatically qualified for the DTC from 2021 onwards. Some things count under the therapy section and some don't. So things like managing your dietary restrictions or exercising do not count towards the 14 hours. And here are some key phrases to include in the application to make sure that you're approved. So we usually say substantially all the time, mostly in every section. We say something like limitations exist despite the ongoing use of medications and therapies. The patient's condition is not expected to improve in such a way that they would no longer be disabled. It takes them 2 or 3 times longer to manage this function when compared to someone their age without any impairment substantially all the time. And unfortunately, you cannot include the ability to work, housekeep, bank, drive, or do recreational activities, but you can focus on how these restrictions in the everyday sense impact you. So saying like due to lack of motivation and focus, or pain, fatigue, you are unable to prioritize tasks like cleaning or organizing, and or things like due to being unable to control your impulsive spending, your family manages your finances. Okay, so here's how to apply. So to apply, you would need the form T2201 completed by a medical practitioner, either a doctor or a nurse practitioner. Certain doctors can only fill out specific sections of the DTC though, and I'll explain this on the next slide. The doctor or nurse practitioner can choose to submit the paper form or the digital form. So we've just got the steps there, step by step. So the first page or part A of the paper form would just ask for the applicant's basic information like name, date of birth, address, SIN number, and you can fill this out yourself. And for the digital form, this section can be filled out online through your CRA My account or by calling the CRA to get a reference number. The rest of the form will be filled out by your medical practitioner, so the doctor or nurse practitioner. So you can either give them the paper form or we can fill it out online and with the reference number that you got from the CRA. Then the form can be sent to the CRA by mail or online. By mail, it would be sent to the Winnipeg Tax Center, which is the address listed there. And we always recommend, the medical practitioner can also submit the form online if you're doing the digital form as well. And it would go directly to the CRA, so you don't have to mail it in. We always recommend that both the applicant and doctor keeps a copy of the application just in case you need to reapply or the doctor needs to give the CRA additional information about your restrictions. So either a doctor or a specialist can fill out the DTC, as I mentioned before. A medical doctor or nurse practitioner can fill out any or all of the sections of the form. So they're able to certify all of the categories that I mentioned before. And an optometrist is only able to qualify someone under the vision category. An audiologist is only able to qualify someone under the hearing category. An occupational therapist can fill out walking, feeding, and dressing, and the cumulative effect of these categories. If you fall under two or more of these categories, so generally people with restrictions in walking usually cannot like stir food that's on the stove, things like that. So they would likely qualify under walking, feeding, and dressing. A physiotherapist can certify the walking section, a psychologist can certify the mental functioning section, and a speech pathologist can certify the speaking section. One question that we get a lot is there a medical practitioner that would be best to fill out the form? So right now there's no preferred medical practitioner. So the doctor that knows you and your restrictions the best and can explain your restriction in detail on the form would be the best person to fill out the form. So after you've submitted the form, it may take the CRA 3 to 4 months to make a decision. They will mail you a letter called the Notice of Determination with the decision if you were approved and how long you're approved for. And if you were denied, what steps you can take. You're also able to check the processing time and status of the application on your CRA My account or by calling the CRA at the number listed, just to check the status and how long it might take them to process it. The CRA might also have additional questions sent to your medical practitioner. The doctor will most likely need to restate most of what was written on the DTC if they get this additional questionnaire. They need to stay consistent with the application submitted and not add any new information that contradicts what was written on your DTC, which is why we encourage doctors and applicants to keep their copy of their application. And they should also include specific examples about your everyday restrictions and how you require 3 times or 2 times longer to perform certain activities or cannot complete certain activities. They need to restate that your restrictions are severe and occur substantially all the time in every category that you applied under. And if it's approved, the notice of determination letter will say whether the approval is permanent and the number of years that you've been approved for. So for example, if you're approved from 2015 to 2030, you might have to reapply if you don't have indefinite approval or approval for all future years. So you'll have to reapply in 2030. And if you've been denied, you can reapply, add more information to your application, or you have 90 days to submit a formal objection to the Chief of Appeals. We recommend reapplying or adding more information to your application because it's a much easier process. So reapplying means that if you're approved from 2015 to 2030, you will need to reapply to receive the DTC from 2031 onwards. So to reapply, you need to complete the same T2201 application for the DTC and have it signed by your medical practitioner again. It's the same process all over again. We find that when people apply for the first time, they're approved for about 5 to 8 years, and then they get indefinite approval or approval for all future years when they reapply. But your doctor or nurse practitioner should always indicate that your condition will not improve to try to get approved for all future years. And I'll pass it over to Catherine to tell you more about the CDB and RDSP.
Thank you, Ophelia. So I'm going to talk about the Canada Disability Benefit, which is the brand new federal benefit that just came out this July. It's designed to help people live with less poverty. So anybody that it does qualify, if you haven't already been approved, you don't have a DTC, applied for the CDB, that's okay. If you're deemed eligible within this time period, you can get retroactive payments as far back as July 2025 for a maximum of up to 24 months. The CDB will not impact your other disability benefits like PWD. So anybody that's on PWD and living off the $1,450 or $1,500 a month will now have an extra $200 a month. It is for people just kind of designed for working age between 18 to 64. So everything is based on the amount of your income and the income of your spouse or partner. So a single person who makes under $23,000 will receive the maximum amount, which is the $200 a month, deposited the same way your GST is deposited. The amount will be less than the $200 and phased out fully by the time you're making $35,000 a year. So for the working income exemption, there is an extra $10,000 a person can make without it affecting the benefit. So the qualifications, you need to have residential ties to Canada for tax purposes. You need to be between the age of 18 to 64. You need to have a valid disability tax credit certificate, and you need to have filed taxes for the most recent year. So if you haven't filed your 2024 taxes, that's really important to receive the benefit for 2025 and the start of 2026. Everything surrounding this benefit is based on income. Because as I said, the goal is to have less poverty. So the income thresholds are unfortunately very low. For that single person, $23,000 is you'd get the total $200 a month amount, and that gets phased out up until the $35,000. And that single person, again, as I said, has a $10,000 working income exemption. Now, if there's a couple where one of them is approved for the DTC and the other person is not, the family income amount is $32,500. The benefit is phased out at $44,500, and the working income exemption is brought up to $14,000. If both the couple, people in the couple, both apply and are both approved for the CDB, their maximum amount for family income is still the $32,500 for the full amount, and then phased out by $56,500, and they've given the same working income exemption of $14,000. So it's really important if a person is 64, and by 64, I mean you're in the year you turn 64. Anytime you're in that year, you're already going to turn 65, even if your birthday is not until September. Just January 1st of the year you turn 65, you will not be eligible anymore. Because you can get back payments for the CDB, it's really important if you are 64, you know that you'll qualify to get approved just so that you can get those amount of months of that benefit. So a person who's approved for the DTC can also open an RDSP. So an RDSP is a Registered Disability Savings Plan, which is created by the federal government as a long-term savings plan for people with disabilities. It can help people even if you don't have the ability to put any money into the account, and it won't affect other disability benefits. So one of the biggest things about the RDSP is that a person can open that account and put a lifetime maximum of $200,000 in that account. Any money that's in that account will not be considered part of your assets against PWD payments. So persons inheriting money, maybe getting money from a lawsuit, or just need money kept so that they can continue getting their PWD, this is a really excellent option. So to qualify, you need to be a Canadian resident, have a SIN number, and be approved for the DTC. So the maximum age that you can be to open that account is in the year that you turn 59. So again, similar to the 64, you have to be in the year that you do that. As soon as you're in the year you turn 60, even if you don't turn 60 for many months later, you are no longer eligible January 1st of that year. So as long as you're in the year 59 or younger, you can open the RDSP. And to be eligible for the grants and bonds, you have to be in the year you turn 49 and younger. So the reason somebody 50 to 59 would want to open the RDSP is they can use it as a basic savings account, and then they can also, as I said, store money there so that it's not counted against their PWD payments. So the grant amounts, if you have a family income of $111,000 or less, for the first $500 you add in a year, every $1 you add, the federal government will add $3. And for the next 1,000, every $1 you add, the federal government will add $2. So if you're able to add $1,500 a year, the federal government will add $3,500. The bonds are a bit different. The bonds are $1,000 a year, every year, up until you're in the year that you turn 49. As long as you've got a family income of $36,500 or less, that's $1,000 every year. And then if your income is between the $36,500 and the $55,800, you can still get part of that $1,000 amount. You don't need to add any money to this whatsoever, and the maximum amount that a person could get would be 20 years worth, which is a maximum of $20,000. Same with the grants as well. Those can run for a maximum of 20 years. So again, the key thing is that age 49. So if a person is 29, they would likely be able to get that 90,000. If you're just 49 now, you can backdate for up to about 10 years. We do have a calculator on our website that you can put in your income, your age, the amount of money you feel like you could probably contribute to the account, and that can give you an estimate of what you might be able to make in that account. So the retroactive claims, if you're in the year you turn 49, you can still retroactively get up to 10 years of those amounts. So again, you have to be in that year you're turning 49 or younger. So the younger you are opening this account, the better it is. Any amount of bonds that you are owed will be given automatically. And it's always good to talk to a financial advisor about how much money you should add in order to get those matching grants. We partner with two organizations, which is BCANS and Plan Institute, and they're really good at helping people learn more about the RDSP, where you might want to open it, how you might want to make your investments. Each financial institution has their own way of running an RDSP. You can't just go into a bank usually to open one. You have to generally call a number. It's a very specific department. If you are approved for the DTC, but you don't have a letter or something yet, but you know you're approved, you don't actually need to bring proof when you go into your financial institution, and you can open the RDSP, as the CRA and the financial institutions have an agreement that if a person does try to open one, they'll let them know if that person is able to. So withdrawals can be made penalty-free once you're in the calendar year that you're turning 60. You can withdraw earlier, but when it comes to the 10-year payment rule, so if it's 10 or more years since the last time the federal government has added money, maybe you're like 55, you haven't had anything added. Sorry, not 55. It'd be like 58. Anyway, sorry, brain moment. Basically, anytime the federal government has added money and it's been within the last 10 years, that means every $1 you take away, they'll take away $3 that they gave you. So as long as you're past 10 years from any government amount, that's fine. But again, within that 10 years, they'll withdraw that money. And that's basically just to make sure that it does stay as a long-term savings plan. For people that are the age 50 to 59 when they open the account, because they're not getting the grants and bonds, they're free to add and take away money in that account without any repercussions that way. So yeah. All right.